Dr. E, welcome, my friend.
Hi, Boomer.
So you and I have met on one chance occasion at Health Optimization Summit. And I know we have just probably like this world, kind of our network grows in fractal-like nature. And so it's nice to be in touch again in this format and actually click record on some of these conversations because you've been pretty proactive when it comes to what the hell is going on in the world these days. And so why don't we jump right into current situations because you've done a lot of research and been very proactive in terms of providing people information with regards to COVID, this pandemic, and what you can do. How do you look at just resilience and immunity in a situation like this? And what are some basic principles that you recommend for people?
Yeah, so I think the starting point is understanding when we talk about resilience, I'm talking about it from a physiological perspective.
Hmm.
Obviously, you have the emotional resilience, which impacts your physiology. However, there are other factors that impact how resilient your physiology is. And one big component of physiological resilience is your immune response, okay? And how healthy that immune response is. It became really fascinating for me and quite emotionally challenging as well with COVID coming in from several perspectives. Here I am as a doctor trained in the UK system, a GP. Outside of that, has been fortunate enough to create my own mini health system, adopting testing the way I want to do testing, therapies the way I want to do therapies. And COVID came along, and the medical system came to a bit of a halt. You know, there is a bunch of expert scientists, physicians, and this kind of system that works really well to some degree with acute conditions and has typically grown through protocolized care. And now came COVID, something we haven't dealt with for over 100 years, a really kind of problematic virus, and everything seemed to go up in the air. The physicians were getting lost in trying experimental drugs and thinking, and I was, and for me, it was emotionally taxing, but at the same time, I felt like we had so much to share, right? Just from the learnings that I'd done in applying functional medicine and other types of medicine and creating this system that I created. So there was two things. One was obviously getting back on the front line, helping out as much as I can. Second was disseminating some knowledge that can be applied without being expensive to apply. So no, you don't need to go into expensive testing, and so just kind of for the masses as much information as possible of how to build that resilience. So going off top, I can talk. So Boomer, reel me back in at any point. And then the third was, how do I engage the medical community? How can I try to influence them? I contacted the local hospital trusts, speaking to their CEOs, say, look, let's help the frontline workers. There are things, IV infusions. They were talking about high dose IV vitamin C. They were talking about use of antioxidants. Hyperbaric now has been shown. It's just common sense, though. To us, it's common sense. If you can hyperoxygenate the blood in a condition where you can't get oxygen in through your lungs into your blood because of the mechanical block, because of the fluid that seeps out from your blood vessels that blocks your expansion of your lung tissue, then hyperoxygenating the blood will help. Ozone therapy. Have you heard of ozone therapy? You will know about ozone, right? Like, again, another way to hyperoxygenate blood, but secondly, also a way to kind of reduce down inflammatory cascades. So we started looking straight away as, okay, what's everyone was saying that COVID's unique. We started looking at basic virology and basic immunology. What happens as an immune response? What are the stages of immune response? What are the components of an immune response?
Mm-hmm.
And then we started to look at what's so unique with COVID-19. And then we came down we understood very quickly that with COVID-19, the people that go on to develop this ARDS, acute respiratory distress syndrome, which is basically leakiness of your blood vessels that drives in the fluid to seep out around your lung tissue, and from which they start to get the patchy consolidation or pneumonia around the lungs. And then the prothrombotic state, which comes later, which gives you the multiple clots and DIC. it's an inflammatory problem. But that inflammation comes day 10. And, what are we doing the first 10 days to reduce the viral replication, to support a healthy immune response, to prevent that inflammatory cascade? And what is it about certain people that causes them to mount such a hyper-inflammatory response?
Mm-hmm.
Now, I'm sure over time we'll find out more about this.
Yeah, so let's double click on a couple of things there. So, in terms of first, those certain groups of people that kind of mount that inflammatory response, what do we know right now, or what have you seen? Because you've been in touch with people on the front line, and the UK has been pretty affected when it comes to COVID. And so, what are some of the commonalities that we see? And then I'm going to come back to you on the first 10 days thing after that.
So, broadly speaking, the stuff that's been published so far has been around the kind of BAME community, has been more affected for various number of reasons. So that's number one broad kind of commonality that's been found. Second commonality that's been found is underlying conditions where their physiological resilience will be less, right? Underlying autoimmune propensity conditions, conditions where people are more likely to develop an autoimmune reaction. So they have kind of rheumatoid arthritis, inflammatory bowel disease, et cetera, et cetera. Those kind of hyperimmune patients. So far, these are some of the early patterns that are evolving, and obviously, the elderly who have underlying multiple metabolic, there's the whole metabolic conditions, which are, the vitamin D deficiency is something that's commonly found. I mean, yeah. So there are a few patterns that are evolving. My theory and take on this is that we all have the genes and the propensity to drive an inflammatory response. Those genes can be turned on and turned off by our environment, right? And my suspicion is that the people that mount a more of an inflammatory response, a hyperinflammatory response, are those that have those genes switched on because of their lifestyle.
Yeah.
Already, right? Because of where their health status is at. How they eat, how they move, how they stress. And it's not something that's static. It's not like, okay, today I ate, moved, slept well, and therefore my genes switched on or off now. It's a creeper.
Yeah.
Disease, death, and, aging, they're creepers. Right. And actually, for me, they start in our 20s. I believe generally, the general population, they probably start in our 20s.
I
start to
completely
age in
agree.
our 20s.
Yeah.
Right. Yeah, does that answer your question?
Yeah, it definitely. So the comorbidities, and also the fact that, to me, an ounce of prevention is worth a pound of cure kind of statement, that makes perfect sense, right? Like, if you've been obese your entire life, you can expect to a certain extent that some of these things may happen to you, and you may be more susceptible to them. Now, you mentioned something earlier about the first 10 days and some of the stuff that we can do there. I would love to hear more about some of the things that you've been talking to the front line in terms of what can we do in the first 10 days to really prevent those extreme situations where people get intubated, for instance, and some of that pneumonia condition.
So the strategy should be, so we do know a couple of another thing, which is the amount of virus you're exposed to will dictate the impact it's going to have on you. So viral load, we know high viral load will have higher mortality, morbidity with that condition. Why is that? Very simply, because when a virus enters your body, it invades one of your cells, and it uses the engineering within each cell to start replicating. Then there's a race that starts, a race between your immune system, your white cells, to keep up with that virus that's replicating, and trying to keep up with that and kill those cells that are replicating. But it's always a lag. There's always a lag, right? And so the bigger the lag, one tends to 2 to 4 to 8 to 16. So if you're exposed to 10 to begin with, 10 to 20 to, you know, to 40, 80,
Yep.
etc. Yeah, exactly. So we know that there are certain things that we can do to support the white cells, the white cells to reduce viral replication. That's why there's advocacy of antiretrovirals very early on. Hydroxychloroquine with zinc. There's been talk about it. You know, it's fascinating the talk about it. And the doses that have been applied to hydroxychloroquine, of course, are going to cause side effects. People are giving 10 times the standard dose of, you know, hydroxychloroquine to people. It's going to cause side effects with it. If you give the kind of normal prophylactic, you know, the normal dose, lower dose, and you start it earlier, that's the key. Start it early, right? Early symptoms, started at a test early, and etc. And so, yeah, hydroxychloroquine with, you know, with zinc, high dose vitamin C. Again, you know, it's vitamin C is used by your immune cells as part of their first line defense. Is stored in the organs of your immune system. It's an antioxidant itself, and therefore it reduces oxidative stress. One of the mechanisms. And then there are obviously other kind of adjunctive things that you can take, and there's kind of herbals like oil of oregano oil has been shown to have anti-inflammatory properties. So things that you want to keep your inflammation propensity down, right? Black cumin seed oil. So these are kind of supplements or herbals you could be taking. There's also kind of mushrooms, medicinal mushrooms that you can take. So there are naturopathic ways to do this to support your systems, beginning alongside some of the kind of, we say experimental drugs. And now, you know, dexamethasone or steroids have been shown to be helpful. Why is that? We know steroids reduce down inflammation or hyperimmunity. Right? So that's why dexamethasone and steroids have been shown to be helpful. So those are things, and then things you can do. So those are things you can take in. Then there's obviously things that you can try and do yourself. And the things that you can do yourself, for me, are more in preparation of if you get exposed to it. You know, starting to eat clean, fix your gut, healthy microbiome. Don't be driving inflammation through your gut. You know, fix gut dysbiosis or leaky gut. You know, I'm saying stuff, Boomer, that I'm sure your listeners would have heard of. So if you want me to explain it, just tell me at any time.
Of course.
Because I've heard it on your show before. So, you know, things like leaky gut, which drives inflammation, inflammatory response, antibodies are created by your immune system to certain foods that escape through the junctions of your gut lining. That's a big source of inflammation. So the things you can do to prepare yourself, reducing down the physiological stress response by controlling our exposure to biological stressors or perceived stresses by our biology, because we know their stress response is related to depleting our immunity. And if we think very simply, you know, of the sympathetic and parasympathetic nervous system, as we all know very well, it's really important. That's kind of real-time physiology. Sympathetic nervous system will keep you alive now. Parasympathetic nervous system will keep you alive later for the longer run, right? And your immunity comes in line for the long run. So it's activated with your parasympathetic. Is, you know, that's when your immune system is really working. And then in the parasympathetic is right now, you know, it's the adrenaline, as we know. So if we think very simply along those lines, there's a couple of things you can be doing: your nutrition, how you control stresses, and everything from blue light blockers to, you know, helping your circadian rhythm, you know, come back aligned with its natural cortisol production through exposure to daylight first thing in the morning, reducing exposure to synthetic lights in the evenings as much as possible, and being just understanding that our immunity is not just the passenger within us. We can actually kind of upregulate it. We can help it.
Yeah. Very, very, very important. Before we go, because there's something that you just touched on there that I love, and we're going to go into that probably for the remainder of the show. But before we go into that, in terms of testing for COVID, is there anything that you've seen that you're like, okay, this is a good idea? Like, should people be getting antibody testing? Do we even know that they work? What do you think about that stuff right now?
So in terms of, I looked at COVID testing because we obviously had a few patients that wanted wanted to get testing done. It was such a dynamic, crazy, and interesting time. Now,
That's why
if
I'm
you are,
asking you, by the way.
yeah,
It's
it
'cause
was, and it's just been like this, you know. And
yeah,
there's been a black market that's arisen from testing, not just testing, global black market. I mean, you probably have people, you know, gloves, alcohol gel, like everything. It's just been
masks. Why not?
masks, yeah. Like it's been wild times, wild west in many ways, and testing fell into that as well, um, to some degree, and so the big thing about testing is the ability to contextualize the test for the patient,
Hmm.
right? In terms of their history, in terms of the examination, and in terms of the test itself, specificity, sensitivity. There are tests that you use to see if you've had it, and those tests are antibody tests. But some tests are more sensitive, specific to know if you've had it within a certain time range, or some are better if you've had it more than 14 days or 28 days prior, right?
Hmm.
Then the question comes in. We don't know how long you'll be circulating antibodies for, in particular, with regards to COVID. We don't have the longevity data, so how long will that test be picking up your antibodies? How sensitive is it for circulating antibodies? And then, so there's IgG and IgM. So that's one test. Then you've got the kind of DNA-based test to see if you've actually got viral DNA in your blood circulating at the moment, and that's they're very good. Now, in terms of the antibody test, the finger prick tests are, some of them are good. No, they're good, but their gold standard right now is a serum test. So taking a bit of blood, send it to a lab, and takes 2 to 3 days and it still looks for antibodies. That's the gold standard at the moment, that's being used in the UK. And then you've got the DNA, obviously, can be taken from the swab. That's why they're swabbing a lot, through PCR. And then around that, so that's just looking at, is the virus within you, or have you had that virus? Around that, you can look at how much it's impacted your immune system. There are other markers you could be looking at. Your white cells are breaking down, your white cells, lymphocytes, etc. You could be looking at your liver function. We know the ACE2 receptors, which COVID impacts, which are in the lungs, are also represented in the liver. And, so some patients, you want to be looking at their liver function tests as well. You want to be looking at how it's impacted their metabolism, their glycemic control during this time, and obviously kind of inflammatory markers, low-grade inflammatory markers, high-sensitive CRP. So there are kind of other generic tests that you can be looking at to complete your picture. And I think it's important to do, actually, if someone's genuinely concerned and if they've got some symptoms.
So this idea of testing, and one of the reasons I actually didn't intend for this to be a very large COVID discussion, but since you're on the front line, I had to ask a few questions. What I wanted to get into with you is the idea of kind of assessing the game field, the opportunities for somebody to build resilience, to improve immunity, and all of these things, in terms of how you look at it with your patients. Because I know you have a very data-driven focus at LMS, and you personally have a background in functional medicine. And so, how do you lay out that game plan for people in terms of testing? What are you looking at?
Sorry, about my dad just coming in. I came home.
Get to meet Dr. E's dad.
Yeah, he's literally just come in and out. Kindly put me a cup of tea. Anyway, so yeah, the laying field for. What was the question?
Let's if you were to determine the playing field for people, because everybody's individual, we know this, right? But there may be some basic principles that if somebody wanted to go out there and get their hands on, or start to really build their own battle plan, how do you do this with your clients? Because there's thousands of tests out there. Not everybody has the thousands and thousands of euros.
That's right. Absolutely.
Where do you go?
Yes, it's a really, really good question. And I think it's one I've been working on for several years. It's like, how do we standardize personalized medicine? Right. And this is an extension of your question. And how do we make sure, the good thing about being trained within traditional medicine is that you really quickly understand that when you're seeing sick people, that, okay, what test is actionable?
Mm-hmm.
I'm only going to test for things that I am going to do something about. If I'm not going to test we don't want to test just to gather information, because what that can end up doing is leading you down rabbit holes, number one, as a practitioner. And number two, can start to create paranoia
Mm-hmm.
patients, because we need to understand the relativity of each of those mechanisms that you're testing for in
Mm-hmm.
that person at that given time.
Mm-hmm. Okay, you've just expanded this into like this becomes a multifactorial problem very quickly, right? And so how do you
Yeah.
look at that?
Yeah. So, I mean, so for me, as I was going through, this is the mindset that I went through for the last 5-6 years, trying to apply an approach to testing that understand that, starts with, okay, what's the relativity of the process? What's the relativity of DNA mutation? What's the relativity of oxidative stress? What's the relativity of hormones, of micronutrients, of digestion,
Mm-hmm.
of, et cetera, et cetera. And we think that the most important
Dr. E, can
foundation.
you just define real quick relativity and what you mean in terms of?
What I mean by relativity is in our processes and systems going on within our body at any given time,
Mm-hmm.
how much of that is going on that produces health or disease at any given time.
Mm-hmm.
I.e., how much of it, if I manipulate it, how much of it's going to move the needle.
Mm-hmm. Okay.
Yeah. So if you think of testing as a pyramid, foundational testing, and now your foundational testing is, let's start with that. For us, foundational testing is gut is very important. Yeah. So we think gut has, we are going to do gut testing. I'll go into that in a second. Hormones.
Mm-hmm.
So hormones are our thermostats within our body. So they essentially control our mood, our energy, our libido, our sleep. And when you look at hormones, you want to look at them as how they are. They're a symphony.
Mm-hmm.
Okay, and they're controlled by the hypothalamus or the pituitary within our brain, and there's negative and positive feedback cycles. And embryologically, the adrenal glands and the thyroid gland come off the same tissue, and they separate. So there's more communication than we understand. And as physicians, we all understand this because we're taught in this scientific core science way. This isn't new to us. We're taught in this core science way in year 1, year 2, year 3 medical school, but we don't apply it.
Mm-hmm.
Because when we apply medicine, we apply, okay, you go to a diabetologist for blood sugar issues. You go to a thyroid specialist. You go to a female doctor for your female hormones. So we start to compartmentalize these things. So hormones are really important, right? So HPA axis, hypothalamus, pituitary, adrenal, thyroid, male or female hormones, that as an axis. Yeah.
Mm-hmm.
So we look at that. That's number 2. So far we talked about gut, digestion, micronutrients, inflammation coming through the gut. 2, hormones.
Mm-hmm.
Yeah, the whole hormonal axis. I mentioned micronutrients, so things that are going to be involved in your energy production pathways, particularly like that's where methylation might come in.
Mm-hmm.
Your B12 folate, your MTHFR, your vitamin D, which actually we classify it as more as a steroid hormone rather than a vitamin.
Because once it goes to 125, it functions like a hormone, right? So
absolutely right. Yeah. Absolutely. And it's amazing, like, when I was like 2000, so back in the early 2000s, vitamin D was never talked about. 2008, I just remember 2007, 2008, we started realizing that everyone was deficient of vitamin D.
Yeah.
Like literally, like you would test, and there was got to the point where there's no point in spending any money on a test because you knew everyone was deficient of vitamin D.
Yeah.
Like when you tested, and we would in primary care, we'll be testing everyone with vitamin D status, and you're like, we know it. Literally everyone was deficient.
You just give it to people, right? You just hey, you need it.
Yeah, you just give it to people. Okay. And so there's those for me are and then obviously you want to be looking for just your general, we put routine tests in there. So your kidney function, your liver function, your complete blood count with differential. So you can see what's happening with your white cells. That's more kind of like traditional medical screening tests that go alongside that. Lipidology is very important. Metabolism,
Hmm.
again, very, the link between, and so for us, lipidology, we want to be breaking down, not just screening lipids. And I was talking to a friend yesterday, who's a physician as well, and her mom had a bit of chest pain, and we ended up talking about cardiology and the approach, and how as an organ it's so important, but still we haven't nailed preventative cardiology very well. How
Not
many
at
people
all.
have heart attacks?
Yeah.
And this is one of the most fatal conditions, right? And we just haven't nailed preventative cardiology
Hmm.
at all very well. And so we were talking about that. And so lipidology comes into that because we're screening HDL, LDL, very basic. We don't go into the lipoproteins. We don't go into the small density. We do. We think it's very important. You understand it. We
So
understand.
you are looking at particle fractionation, right? So
Yes.
you're
Yeah.
okay. Okay.
Yeah. So we look at particle fractionation. We look at your aprotein E gene. We only look at a couple of genes.
Hmm.
The other thing that we look at is metabolism.
Hmm.
We now know, back in the day when we were growing up, when we were kids, it was, and young adults, it was like, low fat diets. That was the thing, like
Yeah, Ansel Keys, right?
fat free, fat free, fat free.
Yeah,
It's just
of course.
ridiculous. Yeah,
You
and
still, I
now
mean, you go to a Dutch grocery store and there's still fat-free everything. So
seriously, yeah,
you can find it. Yeah.
yeah. But this awakening wasn't there. People now are way more awoke to the fact that that is just ridiculous.
Yep.
And the whole like fortified cereals. We used to think Frosties was good for you.
Mm. Yeah,
Anyway,
breakfast of champions, right? Wheaties.
yeah,
But
yeah,
Wheaties, I hope Wheaties don't sue me for this, but
yeah. And so yeah, and now we realize that sugar is the big problem, and and so metabolism is super key, like how, and the link between metabolism and lipidology
Mhm.
is key, and then the link between sugar, cortisol, and now tying in the sugar to the other hormones
Mhm.
receptors. So those are the ideal foundational tests. If someone's looking to, if for us to understand where we can move the needle so that they feel better, and ultimately you will drive people to live longer, but that's not what it's all about. For us, it's about right here, right now. We want you to feel like you did 5 years ago.
Mhm.
Energy
Mhm.
production, mood resilience, digestion, taking the nutrients out of your food as you need to do it,
Mhm.
stronger immunity, because as we age, it's a creeper. It creeps, and we don't. This is the problem. The mindset problem we're in as a society is that we've always been entrenched to believe that we're healthy until we're sick,
Mhm.
right? And that we kind of, especially in the UK, and that's why we're seeing such bad
Yeah.
results in the UK, is that we basically give our health to the medical system. We say, you look after our health. We'll come to you when we're sick,
Mhm.
right? But now we know, we've always known actually, but it's becoming more and more clear that we can control our biology from the real-time physiology perspective, which will impact the long-term health.
Mhm. So one of the things that you just talked about there, in terms of outsourcing health to the government, if you will, which is
Yeah.
a big discussion, frankly, everywhere in the world, right? Like we don't go to the doctor until we get sick, and the doctor is really there just to help us cure symptoms rather than get us healthy. Um, what do you think the tipping point in that discussion is going to be? And this is just something that I'm grabbing out of the air because I'm very curious what you think. Because Malcolm Gladwell, tipping point, and there needs to be more of a discussion and more of action around empowered responsibility. What do you think that is? I have my own hypothesis, but I would love to hear yours.
Okay, so for me, it's all right. The way I see it, all healthcare workers are in it for the right reason.
Mm-hmm.
Yeah, you don't go become a nurse or a physician for the money. Yeah, you're going in there to help people, right? And then
Yeah.
over time, as our health creeps towards a decline, your motivation to, and your autonomy and independence of thinking starts to also become indoctrinated in the system,
Mm-hmm.
right? I think the big lever that hasn't been used well enough is the engagement of that medical community in a language that they're indoctrinated through, right? And what I mean by that is the language of the traditional evidence-based approach, okay? Where there is no point, there is no point us doing this amazing work without trying to present the findings and the anecdotes, because we all have patients and people we work with that have been transformed through these ways of working. How do we standardize it into a language that is presentable to the medical community, that they can just sit back and say, whoa, they can't argue with it. Right now, they just, oh, it's too anecdotal. There's no evidence. There's no evidence because of that whole linear-based approach to evidence, adopting science and innovations through that linear pre-disease, post-disease status. We need to overcome that, and that's going to be overcome, I believe, that we're trying to do through this, helping people understand the processes and standardizing the data pre and post intervention, data point pre and post, and bringing into those data sets kind of real-time markers. We can start with something like this, but there are others, and they will improve over time. But that for me is where if we can, and there's already the awakening starting to happen within the medical community. That's I'm a product of that, right? And there's going to be much more. UK is a little bit behind compared to some of the other places, but there's going to be more of it as more physicians like myself work with more patients who become patient advocates of this type of way of working. So that's one big lever, is the evidence base and how we present that evidence base and standardizing it. And I would love to see some centralization of our evidence through the many practitioners around the world, to say, but the problem that dilutes here is that the education and the approach of is quite variable, right?
Absolutely.
And that's because the education for the practitioners is quite variable. In the education also, there is inbuilt inherent bias within the education, because a lot of the education is given by supplement brands or testing companies. Right? So there's some inherent bias there. So, and that's because, so what we need to be doing is learning some of the great things of the institution of medicine, which is some elements of sharing, learning, standardizing evidence, democratizing expertise, training programs, multidisciplinary team, integrated team care approaches, which is what we're trying to do, create a system that can deliver this. And what I've been working 6, 7 years, 10 years in that mindset of trying to get towards, and it's another 20-year plan. And centralizing, we need support from universities. We need some access to PhDs who can help us mine that data, collect that data globally, and say, okay, how many metabolic patients, pre-diabetic patients have we seen? How many COVID patients have we seen within our network? Okay, what was done? And we've got the technology now. The technology is there to be able to mine the data. It's just about pulling it onto ultimately one spreadsheet. We're talking about spreadsheets earlier, right?
Yeah. I mean, it's about collaboration too, right? And I know Cleveland Clinic and I think Patrick Hanaway in particular and a few others have published papers on just the effects of this kind of approach, which we'll label as functional medicine, right? In terms of that integrative approach, in terms of better outcomes. And I'll link to that one in the show notes as well. But this is absolutely fascinating. Now, I want to, before we get into the rapid fire questions, Dr. E, I want to talk about some of these therapies you mentioned earlier in terms of hyperbaric oxygen and ozone, because at LMS, and I love the place, you guys offer these. Now, we have people listening to this who have more of a performance mindset, in the sense that they're pretty healthy and they're looking for optimization. When we look at, let's just touch on a couple, ozone and hyperbaric. How would you use those in that construct? Maybe even in terms of resilience.
So maybe like in the show notes, would be cool if you can put I'll share it with you, like our complex systems approach to health. I'll quickly go into that to help you understand how I came up with the therapies and how we integrate them and what I see the indications for. Yeah, right. So the way we approached it was, okay, look, let's start with the outputs of health. What are the things that we produce from our, that we would regard as feeling absolutely amazing? That's our kind of, that's our nirvana of health, is that vitality, which is defined as strength and youth, right? So we came up with 14 outputs: energy, mood, sleep, immunity, digestion, inflammation, body shape, hair, skin, etc., etc. Then we said, what are the biological cellular processes and pathways that produce those individual outputs, and how they're interrelated? So we came up with 10 groups of biological inputs, everything from oxidative stress, inflammation, detoxification, micronutrients, hormones, etc. Right? And we obviously know that they're interrelated, so that one of them will be involved with another, and they cause 2 or 3 outputs, not all 14. And then the middle circle is how our environment, how we eat, sleep, move, stress, stuff from the blue zone works and biohacking world, how we can shift our physiology to improve our outputs, right? So it's the interplay between those 3 circles that ultimately drives those outputs. Then we said, okay, let's map the data points attached to the middle circle, the inner circle, the biology. So that we talked about some of that in the foundational testing and the real-time physiology and static measurements you can take. And then we said, okay, now we understand where you're at and where things are going off. What are the therapies that we can apply to some of those 10 groups of things going on, right? So that's how I curated the therapies, and that's how I see them being applied. Hyperbaric oxygen, because we're applying them just like, as you're describing, we're applying it to pre-disease patients predominantly. We're trying to help people feel the best they can feel and perform whatever their, whatever their life goals are, achieve those life goals. Just help your biology work for you, your health work for you, energy when you want it, sleep when deep and restorative when you need it. Because when you sleep better, you have better energy, you have a better day. Yeah, when your mood is more resilient, you're going to make better decisions.
Absolutely.
So we started creating therapy. So in the therapies, we currently use hyperbaric oxygen therapy. We use intravenous IV nutrients, IV laser therapy, German technology, ozone therapy to reduce oxidative stress, reduce inflammation. That's our primary thing. We use ozone therapy. We use 10 pass ozone.
I was going to ask, because 10 pass is the gold.
So
I guess you would call it the gold standard, right?
Yeah, we think it's the gold standard. We're delivering it by clinicians as well, right? So it's we can afford to do, we can do be a bit more aggressive. And we're trained by a chap called Professor Lahodny. He's the one that pioneered the 10 pass in Austria. He's got a few ozone sensors, a surgeon by background in his 80s. Amazing man. So we use that for reducing oxidative stress and reducing inflammation, and supporting detoxification. Like we would recommend doing that once a year for detoxification. Supporting it once or twice a year if you can, within the space of a week or 2 weeks. Hyperbaric mitochondrial health, angiogenesis, so creating micro capillaries, has a massive impact on cognition, in enabling self-healing pathways. It helps drive deeper sleep, stem cell production through the pressure change from your bone marrow as well. So that's how it comes in. We'll put the circle up and you'll see stem cells are in there as well. So that's where hyperbaric comes in. And the Nobel Prize was given just now, but to the scientists that found hypoxic induced factor, HIF, in as the protein that's related to chronic disease over time related to tissue hypoxia, and that was just this year. So we're going to start to see hyperbaric being used a lot more for longevity and preventing disease. So ozone hyperbaric cryotherapy. I think cryotherapy is so underrated in so many ways, and it should be used for people that have performance goals, whether it's physical or otherwise. Typically we say performance we see it as a physical thing, but actually if your biology is performing, you can be the best rock star singer, you can be the best super mom, super dad, whatever. It applies to everything. It doesn't have to just be having six-pack and being ripped, right? It applies to every aspect of life. And so I love cryotherapy, whole body cryo. It shifts your physiology, shifts your, it helps you build that physiological resilience. It shifts your hormone status over time. You start to produce your own growth hormone, your own testosterone, shifts your metabolism as well. You start to speed up thermogenesis and create heat to keep the temperature back up. And that helps to shift your metabolism. So people, if you do that a bit more regularly, it's game changer. And obviously, you want to go down to a therapeutic dose, right? So a lot of the evidence is in the lower temperatures, minus 120, head in, downwards to minus 140, right? And so there are some things to learn about that. And then you're working to develop neurofeedback programs, working with Dr. Andrew Hill. I'm not sure if you've had him on the podcast.
Yeah, I've had Dr. Hill. I've been to Peak Brain as well. So.
Yeah, so we're I love his methodology. It's amazing. A really, really intelligent, smart man, and his team does phenomenal work. And so we're trying to introduce. So ultimately what I do is I have enough core knowledge to be able to curate different approaches and see how they fit into the system, right? And then bring them in. So that that neurofeedback based approach is part of the Mind Lab. And what else are we offering? We're looking at biological approach to that stem cells. UK regulation is very kind of iffy about it, so we always want to be staying within regulation. So we are kind of navigating that, working with some of the professors at Imperial College to develop programs around that. And so that's it for now in terms of the therapy.
It's quite a bit in comparison to what most people have experienced. And
yeah,
I would encourage people to come and check you out in London as well.
And what's quite nice is compounding them. So we can compound the impacts by just understanding mechanically how they work. We put together, we have an Ironman protocol, which is quite nice, which is like an IV, it's giving the IV nutrients into your blood. They're circulating those nutrients, good quality ones. And we know all our food gets broken down into these core nutrients anyway, vitamins, minerals, amino acids. So we give you the core ones, it bypasses your gut for those people that have dysbiosis. Then we activate your cells with these different wavelets of laser energy. So you get red for ATP, UV for reducing parasites. It depends on where someone's at. Yellows activate same pathways as going into the sunlight. Vitamin D production pathways. Then we put you in the oxygen chamber. The pressure drives down and helps those nutrients go into the cells better, right? From your blood. As it does, as it helps, also the oxygen go into your plasma. So you start to circulate. Scott's been on the podcast. He's actually, he's on, he's helped us understand more, and he's consulted, he supports us with hyperbaric as well. So you're now hyperoxygenating all your cells, so the mitochondria in your cells producing ATP. You're giving the nutrients that the DNA will code the cell what to do take those building blocks and make different things. Then we put you in the cryo, causes this constriction and reactive hyperemia of your blood vessels. So you get real delivery everywhere. You get this metabolic shift. You get the kind of hormonal impact. So, people are feeling amazing for 1 to 2 weeks afterwards. It takes them out of this kind of, like, some people, motivation is a big problem for high performers. Hard to, if you're on top of your company, and you've been doing it for a while, 6, 7, 10 years,
you gotta keep going.
Yeah, it's hard, and you've got, it's hard, and the environment is volatile. When you run a company and COVID's a perfect example, right? Like, it's when you own a business, it's a hugely dynamic time. You have to adapt. There's so much. You need clear thinking, and so having your biology working for you is really, really a game changer.
Absolutely, Doctor. You got me really excited, man. I gotta see if the train's running to London today. Just come down and visit you. I want to transition now. I want to transition now into a couple of rapid fire questions before we wrap up. Book which has most impacted your life and how you show up to perform in it.
If I just have to name one, let's start with Why.
Okay, Simon Sinek.
Yeah, I really love that book. Values, purpose, mission, staying core to your core values has been a game changer for me. Interesting for my journey is, like, I started in aesthetic medicine. I was never, I worked in the stem cell industry prior to that. I was I worked in setting up a digital health accelerator, but my sister wanted to, so I helped her do that. I could have been stuck in that, and it's a profitable business. I could have stayed in that, but it wasn't sitting with my core values.
Mhm.
And there was, so that book conceptualized it very nicely, slim
Mhm.
book, and it was a brilliant
Easy to
reminder.
follow.
Yeah,
Yeah,
brilliant
I just
reminder.
remember the line that he repeats often in that book. It's like people don't buy what you do, they buy why you do it, right? And that's great. What's your top trick for enhancing focus?
Ah, a cheat? Can I give you a cheat?
Okay, yeah,
Yeah,
cheat is really good.
GPC, liquid
GPC.
GPC. Just
Okay.
for short term. So liquid. Glycerylphosphocholine, precursor
Hmm.
to acetylcholine. For me, it's just it never lets me down. It's
Good.
so good. It's so good that we actually created our own one.
Yeah, I mean, I
We're
always
working
love
on it at the
hearing the
moment.
cheats, by the way. It's great. And I look forward to trying the liquid GPC when you guys come up with your own one.
I should set up
Oh,
to.
Dr. E, where can people find out more about you?
Um, on our website, on our social media. So I've got at bydr.e is my Instagram, my LinkedIn. I'm starting to use that a bit more frequently. Um, Look, drop me an email if you're in London. Come visit. You'll see things that you're not expected to see at a medical clinic. The
Yeah.
way we deliver health it's a conception. It's there as a museum for people to kind of engage with health. Come
Hmm.
and visit. If you're in London, come and visit anytime. Doors are open
Awesome.
for people that are interested in health. Yeah, so
Awesome.
that's just come. I'm always at work, pretty much, sadly,
It's,
and happily.
but if you love what you do,
I
that's what
do.
matters.
I do.
Because I'm a very firm believer if you love what you do, you can work. And there's that phrase, you never work a day in your life. I'm not sure I necessarily believe that because certain days are harder than others, but it's a good one.
I think we're as you briefly mentioned this earlier, we're so blessed to be in a space where we feel that we can contribute back to society positively
Hmm.
through our work,
Hmm.
and it's helping the adoption of new ways of working that can further the improvement and that can have a wider impact. And that's why that's why you're doing what you're doing. That's why I'm doing what I'm doing, right? Is ultimately it's not about us as individuals or the core people we work with, but hopefully through this podcast, through what you're doing, you're going to be inspiring more people that, yeah, actually you can take control of your biology. And who knows, there might be a PhD researcher, there's going to be ripples.
Hmm.
And it's from our intention that this stuff happens, like we're authentic intention and hard work keeps us going. And then the universe seems to respond to that, right? Because the universe wants improvement, wants good stuff to happen.
Cheers to the ripple.
Yeah,
That's a
bro.
great place to leave it. Dr. E, I look forward to conversing more, hopefully in your
Absolutely.
hyperbaric chamber in
Yes, we should
London.
do a session in that.
Absolutely. I'm gonna get myself pregnant with that right now. Let's do that. That'd be a lot of fun. We're gonna have to
Let's do
release
that.
the video too.
Yeah, let's have to
Dr.
do
E,
that.
thank you so much. It's been a
Been
pleasure.
amazing. Take
To all
care.
the superhumans listening out there, have an epic day.